All right, so we're back in, and I'm going to take these off the board because we are now in Neuro. Neuro is our last home stretch here for the day. All right, and Neuro, so for Neuro, I like to break Neuro down this way. Let me see if I can do this on video. I like to talk about two things when I'm talking about this. Level of consciousness versus orientation. Okay, why do I do this way? Because you all typically come to me with the AO times 4, right? You know that one, if I say that to you all, my ABNs. What does that mean? Alert and oriented times 4 to what? Name, time, place, person, situation. So I parse these out separately for my learning at this level, because when we're talking about level of consciousness, I'll give you your alert and I'll give you your oriented times 4. That's what you're saying to me. But these have a spectrum that decreases all the way down. You recognize that. At the bottom of the level of consciousness scale, what do we have down here at the very, very bottom? Level of consciousness at the very, very bottom is comatose. Or what? Attended. Oh, that word before? There is no level of arousal. You have a Glasgow coma scale for that. That's posted on Canvas to tell you more about Glasgow coma scale. How much of a coma are they in? What's your level of responsiveness to coma? Right? How deep is the coma? Between being fully alert and comatose, in terms of consciousness, what are other words? Right? If I'm not fully alert, lethargic. What else? Drowsy. What else? Confusion on this side, orientation, confusion. That's where this is where it gets tricky. That's why I parse them out. Is confusion a level of consciousness or an orientation? It is an orientation, exactly. That's why I want to make sure I'm parsing them out in your brain. I'm taking it to a different place. Confusion goes, if you want to mix them up. How alert are you? Your level of consciousness, my level of awareness about things decreases down. I'm not fully alert. I'm drowsy. I'm lethargic. What else could I be? Sleepy. What else? Unresponsive. Unresponsive to stimuli.
Responding to pain.
Response to pain. You get where I'm going? Make sure you got all my ones I like. Oh, stuporous. That's in here somewhere too. Like maybe like a little drunk. Let's see. Lethargic, obtunded. Oh, the other one, I go in here somewhere. We say semi. Comatose, you may have seen that one somewhere, right? Remember these level of consciousness scales? Now, orientation times 4, you say, big one. I'm oriented, time, place, person, situation, you say. At the lowest end, what am I? What might I be? You say ANO 0.
Disoriented.
That's A and O, alert, you're doing this, and O times 0.
Disoriented.
So give it to me in your language. Where do you want to go? No, give it to me, come on, give it to me.
Unresponsive.
Did you like that one, you all?
No, because we said oriented times 4, so disoriented times 0.
So you're saying oriented
Oriented times 1, oriented
times 0? Is that what you're telling me at the bottom of that scale?
Disoriented. Unresponsive.
See where I'm going? See what I'm doing to your brain? I love doing this to your brain. I do. This is baccalaureate nursing, right? What does this mean? Responsiveness or orientation? Orientation. Don't get them confused.
Don't know their needs, they don't know their time, they don't know the place, they don't know.
What kind of patients are down here? Thank you. Dementia. Yeah, okay, we're getting somewhere.
I'm thinking the chart is not
Who else?
working.
Well, disorientation times 4, we could say that, but let's be more descriptive. Your charting system may have limitations, but I can narrate this different. Who else? I heard you say that. Alzheimer's. Right? They may know part of stuff, but they can't remember. I can't remember. Okay, that starts a little bit up here. If I'm not completely oriented times 4, what might I be at the little subtle age? A little forgetful. I'm not, what's your name? I'm just a little forgetful. Right? You get where I'm going? I'm not A and O times 4, maybe I'm A and O times 3.5. Sometimes I know my name, sometimes I don't. Sometimes I know your name, sometimes I don't. 2, 3, you know where I'm going? Right, I go in and out, right? A little forgetful. That might be a little start of my orientation, how oriented I am to what else? What other words? You get where I'm going? What else might I be? Delirious. I'm really out of it. Might be just really out of sorts, right? What else? Look at my words here. Okay, you ready for the complicated ones? Wait, hold on, let me, okay, wait, I'm gonna get my easy ones. Forgetful, confused. Delirious. Disoriented, might be another word. You're disoriented. You might be a little more descriptive there. Now I'm gonna, I get all of them? Yeah, okay. So you get the difference. And I parse them out. So question? Where's catatonic fall? What is catatonic? Is it a level of consciousness or an orientation? What is catatonic to you? Are they eyes open alert? I'm alert? Aware of my surroundings or no? What am I? Catatonic. I'm like, am I catatonic? What am I? Is it a level of consciousness thing or an orientation thing? What do you think?
I think it's level of consciousness because they're not responding.
Catatonic, that's a good one. That's psych. I'm not a psych nurse. I have to look that one up. I'll put catatonic up here. So are they alert? They were kind of sitting there like this. Are they able to talk?
No, they can't talk, they cannot move, they can't.
They're just
do
like
anything.
stiff.
They're just stiff, because they're
Over medicated, but they're alert.
I don't know, you can't.
Eyes are open?
Eyes are open.
They're not drowsy, stuporous, sleepy, blah. Alert. So to me, it almost feels like it's leaning here. Okay. They can't talk. We're doing speech next. Oh, wait. So makes me, I'll put question mark here because might be this is a speech.
There's no speech.
speech.
Because if we're talking speech, which is another one we assess with neuro, is it just that I can't speak? But I could be completely aware and alert of what's going on. I know what time of day it was. Here's my example, students. I'm alert. I just had a stroke. You wake me up first thing in the morning, I'm feeling good. I'm alert, I'm oriented ×4, if I could, but I've had a stroke. So I'm now aphasic. But I could write, if you ask me, I could tell you, it'd be right. If you ask me to speak it, and I want to tell you good morning, I may say, shoo, right? So I'm trying to say good morning, but it didn't come out right. But I'm alert and oriented. Get where I'm going? So these things be mindful of when you're making, I'm almost putting catatonic up here with a face. Part of me wants to say this is a speech thing. Because are they any problems here in the level of orientation, or is it that they just can't speak to me because I over-medicate them or they're medicated to a place that they're not by? What do you got?
It says immobile or unresponsive stupor.
So we're saying physical,
Or physical
and then we're saying stuporous.
Yeah.
So they're putting them here.
Unresponsive stupor.
But at the same time, it says lack of verbal response.
It says what?
Lack of verbal response.
Then it is here, speech. It's a verbal thing. This is where my mind goes with it, but see, this is where it gets tricky, right? So they're not saying it's anything related to orientation.
Lack of movement and communication.
A lack of movement, physical, mobility, and communication, speech. Is my brain still aware? I'm catatonic. I may be completely aware, but you just put so much darn whatever you put in board on me. I can't do nothing but be catatonic. It sounds like what they used to call a K-hole. For those who know anything about recreational drugs, you go into a K-hole. You ever heard this term? K-hole. Anybody look that one up? K-hole. You're laughing. You must know something. Or schizophrenic. I'm aware of what's going on. I'm just in that space.
Right. So it doesn't-
Maybe it's a heroin thing. I'm just faint. I'm feeling good. Leave me alone. I may be right. I'm nodding like this, but I'm feeling good. Don't bother me. It's my substance use folks I work with. Right. K-hole. They call it a K-hole. Vitamin, ketamine.
No.
Yeah. Anybody know about, you heard about this?
Hallucinate and stuff.
But they're not hallucinating. They're just in the K-hole. They just can't, they're catatonic. Ketamine, they can't move. It's a horse tranquilizer.
Yeah, because ketamine, I do ketamine infusions, because I'm an infusion nurse, and we have to give like Ativan and Valium and stuff, so they start hallucinating, or they're like.
Well, that's, you don't want to move it around. That's probably because you want to make them immobile to be still for something, right?
Well, it's because they have chronic pain disorder,
Oh,
so they get ketamine infusions for it.
really?
Uh-huh.
Are they able to get up and move around after that? That must be a low dose.
Well, they're like kind of like, they have to have somebody with them at all times.
Ooh,
Because
that's
their eyes are all jiggly.
Yeah, and I feel that's ordered.
Interesting. Okay, interesting. Okay, we got level of consciousness and we got orientation. All right, so then we go to speech clarity, fluency, and congruent. So is the speech clear, garbled, absent? Huh? Slurred, yes. Which could be medication, it could be something else. Stroke. Congruent has to do with, is the speech appropriate for what is being asked? There's a connection, a congruence between the two. Ideas are connected. Ideas connect. So when you say to me, we're talking to, yeah, cars driving on the river. Yeah, that might not make, yeah, right. That's a little disconnect. There's a little lack of congruence. Does the language flow? Is there stuttering? Yes, or I'm trying to read my notes here and Stan. What is that word? Oh, I can't even read it. Okay, I can't read it. Okay, to situation, to certain questions. God, I can't read some of my writings. Oh, flight of ideas. Flight of ideas. Or pressured. When I'm talking to you, I'm so like, the speech is pressured. There's not a nice flow to it. I can't read that word. That's interesting. Okay. That'll teach me. Oh, I think that says slurred. And this says something you can't read here either. Okay. And then we go down, it says neurological assessment and then deep tendon reflexes. So this information I would gather from my patient in my initial introduction to them. Hi, why are you here? Right? I can tell that in my initial why are you here statement, right? This would be where I would pick this up. The speech, hi, what brings you in today? I'm here for an exam. Oh, that tells me their level of alertness. That tells me their level of orientation. They know where they are, why they're here, what's appropriate. I could assess their speech, if it's congruent, if it's no slurring, no stuttering, no kind of impediments, appropriate for conversation, right? Appropriate to circumstances or condition. I'll give you more words. Make sense? I've gotten all that from that initial, how do you do? And then it says sensation, strength, times 4 extremities. Then I'm going to assess the gait. I'm going to do Romberg, and then I'm do some graphesthesia stuff. And then I'm going to do my deep tendon reflexes. So for this one, it's the sensation strength test we did before, right? Upper and lower. You know how to test strength, right? Can they push back, push and pull? Sensation test, sharp and dull. I was talking to you all who had some of that on the face test. I bought these, got the Q-tips out for this today. I use these, take them home a sample. That way I make one sharp end, let me show it on film, and one dull end. And don't be afraid to stick it to them. So if I'm testing, oh, gotta go on camera. If I'm gonna be, because you guys are so gentle, stick them so they can tell. Don't jab it in there so they can bleed. But their brain needs to, with the eyes closed, their brain needs to be able to register if in fact their brain can register. Is that soft or sharp or dull, right? Of upper and lower extremities, sharp or dull. Close your eyes and tell me what you're feeling, right? And same thing with the lower extremities. Same thing down here. There. That's a good one. Rest it. Sharp or dull. Hey, that'll do it. Oh, I did it. It's on video. Okay.